Maternal Newborn Family Planning Review Quiz with Rationales. Question 1. The nurse is monitoring a client who is 34 weeks. Guess dividing? Option A. Trophoblast or inner cell mass that becomes the fetal monitor tracing are a priority for the nurse to placenta. Option B. Embryoblast or inner cell mass that becomes the that apply. Embryo. Option C. Baseline FHR 140 accelerations, late decelerations. Option D. Morula. The correct answer is option A. Trophoblast or inner cell mass that becomes the fetal monitor tracing are a priority for the nurse to placenta. In the context of the question, the nurse is monitoring a 34-week gestation client. Question 2. A nurse on a postpartum unit is receiving change of shift report for 4 clients. Which of the following? Option A. A client who gave a birth 1 day ago and needs Reuro superscript 1 superscript 3D immune globulin. Option B. A client who gave a birth 3 days ago and reports breath fullness. Option C. A client who gave a birth 12 HR ago and reports an increase in urinary output. Option D. A client who gave a birth 8 HR ago and is saturating a perineal pad every hour. The correct answer is option B. A client who gave a birth 3 days ago and reports breath fullness. The client who gave birth 3 days ago and reports breath fullness is showing signs of potential postpartum complications, such as a pulmonary embolism. Question 3. A nurse is admitting a client who is at 35 weeks of gestation and is experiencing mild vaginal bleeding due to placenta previa. Which of the following actions should the nurse plan to take? Option A. Initiate continuous monitoring of the FHR. Option B. Administer a dose of betamethasone. Option C. Check the cervix for dilation every 8 HR. Option D. Request that the provider prescribe misoprostol PRN. The correct answer is option A. Initiate continuous monitoring of the FHR. In placenta previa, the placenta partially or completely covers the cervix, which can lead to vaginal bleeding. Question 4. A nurse is assessing a newborn who is 48 hours old and is experiencing opioid withdrawals. Which of the following findings should the nurse expect? Option A. Hypotonicity. Option B. Moderate tremors of the extremities. Option C. Axillary temperature 36.1 degrees Celsius, 96.9 F. Option D. Excessive sleeping. The correct answer is option B. Moderate tremors of the extremities. Neonatal opioid withdrawal syndrome, also known as neonatal abstinence syndrome, NAS, can occur in newborns who were exposed to opioids in utero. Question 5. The nurse is educating a G1P0 client who is 34 weeks in the 3rd trimester, gestation and in her 3rd trimester. Which of the? Option A. I should gain 3.5 to 5 pounds in the first following educational topics would be appropriate trimester and 1 pound per week in the last 2 at this time. Select all that apply. Trimesters. Option B. Contraception options after delivery. Option C. I should gain 10 pounds in the first trimester. Option D. Group B strep, GBS, screen before onset of labor 10 pounds in the 2nd trimester and 10 pounds. The correct answer is option A. I should gain 3.5 to 5 pounds in the first following educational topics would be appropriate trimester and 1 pound per week in the last 2 at this time. Select all that apply. Trimesters. In this scenario, option A is the correct answer. Question 6. Which statement is the most accurate to make dense about the highest risk group for gonorrhea? To the parents of a newborn during discharge, what is the age range of the clients? Option A. 36 to 45 years. Option B. Meconium stools should be expected to resolve. Option C. 14 to 25 years. Option D. 26 to 35 years. The correct answer is option C. 14 to 25 years. The age group of 14 to 25 years is considered the highest risk group for gonorrhea, making it important to discuss this with parents during discharge. Question 7. A nurse educator is teaching a class to nursing developing cervical cancer. Which client is at students about the incidence of sexually transmitted highest risk infections, STIs, and their impact on public health? Option A. Client with a Pap test and an HPV screen positive, which is the most commonly reported STI in the for type 12 United States. Option B. Client who is 40 years old and stopped smoking. Option C. Syphilis. Option D. Gonorrhea. The correct answer is option A. Client with a Pap test and an HPV screen positive, which is the most commonly reported STI in the for type 12 United States. Human papillomavirus, HPV, is the most commonly reported sexually transmitted infection, STI, in the United States. Question 8. A nurse is providing dietary teaching for a client who is at 29 weeks of gestation and has phenylketonuria. Which of the following suggested foods should the nurse include in the teaching? Option A. A peanut butter sandwich on wheat bread. Option B. A sliced apple and red grapes. Option C. A chocolate chip cookie with a glass of skim milk. Option D. A scrambled egg with cheddar cheese. The correct answer is option B. A sliced apple and red grapes. Phenylketonuria, PKU, is a genetic disorder where the body cannot metabolize phenylalanine, an amino acid found in protein-containing foods. Question 9. A nurse is caring for a client who is receiving oxytocin to augment labor. The nurse notes recurrent variable decelerations. Which of the following actions should the nurse take first? Option A. Prepare the equipment necessary to initiate an amnio infusion. Option B. Administer oxygen at 10 L/min via non-rebreather face mask. Option C. Discontinue the infusion of oxytocin. Option D. Place the client in a left lateral position. The correct answer is option C. Discontinue the infusion of oxytocin. Recurrent variable decelerations during labor can indicate umbilical cord compression, which can result in fetal hypoxia and distress. Question 10. A nurse is assessing a newborn who was born vaginally with vacuum extractor assistance that crosses the suture line. The nurse should identify the swellings as which of the following? Option A. Nevus flammeus. Option B. Caput oxydaneum. Option C. cephalohematoma. Option D. Erythema toxicum. The correct answer is option C. Cephalohematoma. Cephalohematoma is a collection of blood between the skull and its periosteum that occurs due to rupture of blood vessels during birth trauma. Question 11. The nurse is educating a prenatal client about weight dysphoric disorder. Which statement by the client gained during pregnancy? Which statement by the would require immediate follow-up? Client indicates effective understanding. Option A. I have been crying the week of my period. Option B. I should gain 2 to 4 pounds in the first trimester. Option C. I am experiencing suicidal thoughts, and half a pound per week in the last 2. Option D. My menstrual cycle is 1 week late. Trimesters. The correct answer is option C. I am experiencing suicidal thoughts, and half a pound per week in the last 2. Correct answer C. I am experiencing suicidal thoughts. Rationale: this statement indicates a serious mental health concern that requires immediate follow-up. Question 12. A newborn is suspected of having substance abuse instructions. Exposure. Which of the following assessment findings? Option A. Exercise will decrease my metabolism and should the nurse expect? Select all that apply. Option B. Increased weight gain. Option C. Starting on glucophage will take the place of. Option D. Seizures. The correct answer is option D. Seizures. Seizures. Substance abuse exposure in a newborn can lead to withdrawal symptoms, including seizures. Question 13. Which newborn is at highest risk of a skin infection? Of the FHR? Option A. Infant born at 36 weeks who is being bottle fed. Option B. Right lower abdomen. Option C. Infant whose umbilical cord fell off on day 8 of life. Option D. Near client umbilicus. The correct answer is option C. Infant whose umbilical cord fell off on day 8 of life. The newborn infant whose umbilical cord fell off on day 8 of life is at highest risk of a skin infection. Question 14. A nurse is monitoring a client who has preeclampsia and is receiving magnesium sulfate by continuous 4 infusion. Which of the following findings should the nurse reports to the provider? Option A. Blood pressure 148/94 mmHg. Option B. Respiratory rate 14 mm. Option C. Urinary output 20 ml/hr. Option D. 2+ deep tendon reflexes. The correct answer is option A. Blood pressure 148/94 mmHg. Blood pressure 148/94 mmHg. High blood pressure in a client with preeclampsia indicates worsening condition and potential for eclampsia. Question 15. A nurse is assessing a client who is at 37 weeks of gestation. Which of the following statement by the client requires immediate intervention by the nurse? Option A. It burns when I urinate, my feet are really swollen today. Option B. Didn't have lunch today, but I had breakfast this morning. Option C. Have been seeing spot this morning. The correct answer is option D. RN Maternal Newborn Online Practice 2019A. Question 16. Which action is the most appropriate nursing measure when a baby has an unexpected defect at birth? Option A. Remove the baby from the delivery area immediately. Option B. Inform the parents immediately that something is wrong. Option C. Tell the parents that the baby has to go to the nursery immediately. Option D. Explain the defect and show the baby to the parents as soon as possible. The correct answer is option D. Explain the defect and show the baby to the parents as soon as possible. When a baby is born with an unexpected defect, it is crucial for the nursing staff to explain the defect to the parents and show the baby to them as soon as possible. Question 17. The nurse is seeing a 17-year-old female in the clinic for complaints of acne. The nurse plans on taking advantage of this teachable moment with the teen. Which topics will the nurse include in the teen's teaching plan? Option A. Smoking habits, folic acid intake, and heart disease. Option B. Hyperlipidemia, distracted driving, and menstrual history. Option C. Sexual activity, contraception, and screening for violence. Option D. Optimum weight, hypothyroidism, and sexually transmitted diseases. The correct answer is option D. Optimum weight, hypothyroidism, and sexually transmitted diseases. The most appropriate topics for the nurse to include in the teaching plan for the 17-year-old female with acne are optimum weight, hypothyroidism, and sexually transmitted. Question 18. Which nursing diagnoses may apply to the childbearing family with special needs? Select all that apply. Option A. Risk for spiritual distress. Option B. Risk for injury. Option C. Readiness for enhanced nutrition. Option D. Ineffective breathing pattern. The correct answer is option B. Risk for injury. Risk for injury. This is because families with special needs in childbearing may face unique challenges leading to potential risks of injury, such as physical limitations or. Question 19. Which of the following serve as maternal risk factors due to having a baby who may suffer from birth trauma? Option A. Take her supplement after a meal. Select all that apply. Option B. Take her supplement with full glass of tea. Option C. Term delivery. Option D. Scheduled cesarean delivery. The correct answer is option D. Scheduled cesarean delivery. Scheduled cesarean delivery serves as a maternal risk factor due to having a baby who may suffer from birth trauma. Question 20. A nurse on the labor and delivery unit is assessing 4 clients. Which of the following clients is a candidate for an induction of labor with misoprostol? Option A. A client who has active genital herpes. Option B. A client who has gestational diabetes mellitus. Option C. A client who has a previous uterine incision. Option D. A client who has placenta previa. The correct answer is option C. A client who has a previous uterine incision. Misoprostol is a prostaglandin E1 analog that is commonly used for labor induction. Question 21. A community health nurse is providing education on gestational diabetes mellitus, GDM, to a group of clients who are pregnant. When discussing risk factors, which of the following ethnicities should the nurse identify as having the lowest incidence of GDM? Option A. Asian. Option B. Non-Hispanic white American. Option C. Hispanic. Option D. African American. The correct answer is option B. Non-Hispanic white American. Non-Hispanic white Americans have been reported to have the lowest incidence of gestational diabetes mellitus, GDM, compared to other ethnicities. Question 22. A patient has delivered twins. The first twin was stillborn and the second is in the intensive care nursery, recovering quickly from respiratory distress. The patient is crying softly and says, "Wish my baby could have lived." What is the most therapeutic response? Option A. How soon do you plan to have another baby? Option B. Don't be sad. At least you have one healthy baby. Option C. Have a friend who lost a twin and she's doing just fine now. Option D. I'm so sorry about your loss. Would you like to talk about it? The correct answer is option D. I'm so sorry about your loss. Would you like to talk about it? Because it shows empathy, acknowledges the patient's loss, and invites further discussion if the patient wishes to talk. Question 23. Which complication of adolescent pregnancy should the nurse plan to monitor? Option A. Anemia. Option B. Placenta previa. Option C. Abruptio placenta. Option D. Incompetent cervix. The correct answer is option D. Incompetent cervix. Incompetent cervix, also known as cervical insufficiency, is a condition where the cervix begins to dilate and efface prematurely due to weak cervical tissue. Question 24. Which data in the patient's history should the nurse recognize as being pertinent to a possible diagnosis of postpartum depression? Option A. Previous depressive episode. Option B. Unexpected operative birth. Option C. Ambivalence during the first trimester. Option D. Second pregnancy in a 3-year period. The correct answer is option A. Previous depressive episode. A previous history of depression is a significant risk factor for postpartum depression. Question 25. Which of the following conditions is concerning to the nurse recognizes which as a risk factor for placenta the infant nursery nurse? Abruptio? Select all that apply. Option A. An infant who passes a thick, greenish to black. Option B. Use of alcohol stool with each bowel movement. Option C. Hypertension. Option D. Hard, small, white papules on the face of the. The correct answer is option C. Hypertension. Correct answer C. Hypertension. Rationale 1.